This Innovation in Science Advice session, COVID-19 Reshaping Science Advice, is presented by the Canada Foundation of Innovation. Please welcome our moderator, Dr. Mehrdad Hariri, CEO and President of the Canadian Science Policy Centre.
Hello, my name is Mehrdad Hariri, and I am the CEO of Canadian Science Policy Centre. First, I would like to acknowledge the land I'm talking from. I'm talking to you from Richmond Hill, Ontario, in Canada, which is the traditional land of Wenda, Haudenosaunee, and Anishinaabe peoples, whose presence continue to this day. We thank them and other Indigenous peoples for sharing this land with us. Welcome to INGSA Biannual Conference and the session titled Innovation in Science Advice. During the 3 days of sessions, INGSA is pleased to bring to you a series of fascinating presentations, stories from around the globe, all about the interaction of science and policy and science advice for policymaking. Today, in the first series of short talks, we will explore the various models of science advice who have emerged during the COVID-19 pandemic. The pandemic has had extraordinary impacts on our lives. No country left immune from its devastating impacts. It's changed many aspects of our societies. But pandemic also brought science into the center of attention. In particular, brought science closer to policymaking. The need for science and scientific advice for policymaking became an urgent matter. It is not exaggerating to say the pandemic was a turning point, a paradigm shift in connection between science and policy. Scientific advice is a complex process. However, in the time of crisis, it became even more challenging, especially when facing a new virus and a global pandemic, where data is changing, reaching a conclusion and consensus is hard, and communicating the complexity and uncertainty of data to policymakers who expect to receive a timely and certain response is a huge challenge. Governments were desperately looking for scientific advice and accurate information on how to face this new and unprecedented challenge. The need was felt among both policymakers and academic community all over the world. There were huge efforts to establish new advisory councils and committees and online platforms to develop timely, independent, peer-reviewed, and reliable scientific information and advice that can be communicated in a meaningful way to policymakers. These efforts have been global, and today, as part of the INGSA Biannual Conference, we would like to bring to you a few of those examples from various countries, presenting the new and innovative approaches to science advice that have emerged as a result of the pandemic. Some countries who had existing infrastructure of science advice felt the need to upgrade or even establish new mechanisms that are more agile, like Australia, which already had science advice infrastructure. But they felt there is a need for innovative mechanisms to ensure a more timely science advice. The countries with no formal structure of science advice, they established new mechanisms for that. In Costa Rica, academic professionals developed a decision-making platform with information of variables related to this disease. In Vietnam and Finland, countries with no established mechanism of science advice, they developed new ways of how to get scientific advice to policymakers. Let's together listen to these fascinating presentations and learn about the practices and new models of bringing science to policy.
I wish to acknowledge the Ngunnawal people, the traditional owners of the land from which I speak, and I acknowledge First Nation peoples around the world as custodians of knowledge critical to understanding our world and informing our decisions. At the beginning of 2020, the Black Summer bushfires impacted millions of Australians, causing 33 direct and 445 indirect deaths. I pause to offer my thoughts to those affected by the extreme weather and devastating bushfires that have ravaged Canada and other parts of the world. In Australia, as our cities choked with bushfire smoke, the COVID-19 pandemic took hold and put most of us into lockdown. In a time of crisis, it was quickly apparent that the Australian government lacked mechanisms to ask for and receive multidisciplinary science advice quickly, and that their questions were of a nature that only science could answer. To be clear, Australia has highly developed advisory mechanisms in some domains, particularly in health and agriculture, as well as evolving mechanisms in the environmental domain. But our country has no formal mechanism to routinely draw upon the immense knowledge held by researchers across disciplines across the country, either in normal times or in a crisis. Of course, the Australian Chief Scientist is a key advisor to government, but unlike the Australian Chief Medical Officer, the Chief Scientist's formal role is broad in nature and mostly defined by the incumbent. The response to these twin crises was the formation of an innovative science advisory structure in April 2020 that would become known as the Rapid Research Information Forum, or RIF. The formation of RIF provided Australia with a unique whole-of-government tool for navigating the science policy interface, drawing on the known capabilities of Australia's learned academies as trusted sources of authority and excellence, as bodies able to convene expertise wherever it resides, and as independent organisations. Less tested was the capacity of learned academies to produce advice rapidly. The truth is, the job just had to be done. The vast unknown that was, and in some respects still is, the COVID-19 pandemic, meant we could not afford to waste or exclude the extraordinary scientific expertise that resides within our country and beyond. And by scientific expertise, I mean multidisciplinary knowledge, including the natural and social sciences and the humanities. The RIF was convened by the Chief Scientist of Australia, and its participants included Australian and New Zealand Learned Academies, the Australian Council of Learned Academies, state and territory chief scientists, the CSIRO, national peak bodies for research and universities, and members of the National Science and Technology Council. Through its membership, RIF enjoyed unparalleled access to multidisciplinary research expertise, both domestically and globally. RIF responded to questions put by Australian government ministers through rapid peer-reviewed reports that synthesise the latest multidisciplinary evidence base. Important features of the RIF reports include that they're written for a policy-literate audience. They are independent. They express uncertainty in a systematic way, similar to the methodology adopted by the Intergovernmental Panel on Climate Change in their reports. And most importantly, they do not make recommendations explicit or implied. However, they do provide actionable evidence so that decision makers feel guided and enabled to make decisions. The RIF reports had to be produced rapidly as the evolving situation washed up onto our shores. Most reports were delivered within 14 days. However, the Forum was able to deliver some within 7 days. The first report, outlining the impact of winter on the likely spread of COVID-19, was delivered in under 5 days. I don't suggest adopting this practice, something I refer to as madness, not innovation. Over the first 12 months of the pandemic, RIF produced 13 public reports. Some provided scientific evidence the government simply didn't have. Others were more traditional synthesis documents, for example, bringing together the status quo on vaccines and therapeutics under development at the time. We discovered that in a crisis, it is possible for learned academies to gather meaningful and accurate evidence to inform government decision-making. The capability requires learned academies to have already developed policy capability and science communication resources that can be readily accessed. As well as leading the preparation of some of the reports, the Australian Academy of Science provided the central engine room for RIF. This meant providing process support for all RIF participants and ensuring accuracy, readability, consistency, and quality assurance across all of the reports. Paramount was the role of the Chief Scientist, who played a critical role in this knowledge brokerage exercise, helping ministers frame questions so they had most meaning, working with the Learned Academy leading the drafting of any one report, and liaising directly with subject matter experts to explore nuance and ensure accuracy. We learned that whilst testing at times the establishment of RIF was deeply satisfying and was well worth the effort. Looking beyond the pandemic, our challenge is to sustain innovative scientific advisory mechanisms so that evidence can routinely inform government's decisions on any subject matter. That is, a mechanism that continues to be multidisciplinary, independent and timely, and a mechanism that is sustainable given the RIF model is resource intensive for all involved. Finding ways to recognise the contribution of researchers will also be important. It's uplifting to learn that the reports delivered to ministers throughout 2020 were welcomed by them. They informed their decisions, and they have since expressed genuine enthusiasm to make this model a standing part of the government's advisory architecture. Separate but related, it's also encouraging that the Australian Parliament is currently discussing whether it's time to develop its own legislative science policy advice mechanisms for all parliamentarians, not just government ministers. This would be a model more akin to the Parliamentary Office for Science and Technology in the UK, rather than a RIF-style model. RIF offers a case study for how the pandemic has taken a conceptual framework to a practical, evolving mechanism for the routine delivery of timely, independent and relevant scientific evidence to inform policy decisions. And whilst no one wished for a pandemic, the opportunity allowed us to demonstrate how learned academies can effectively put science at the service of the nation.
Hello, my name is Diego Quirós. I'm a professor and researcher at the School of Statistics at the University of Costa Rica. For me, it's a pleasure to present to you part of the work carried out by a multidisciplinary team of researchers at our university. First of all, I want to mention that COVID-19 pandemic has put the Costa Rica government in a difficult position in various aspects, including decision-making based on scientific knowledge. Despite having a health system classified among the best in Latin America, there are areas that still require important improvements. One of them is the use of new technologies and interoperability of information systems, as well as a clear definition of processes for collect, process, and especially share information among government institutions. Another improvement is using big data tools to analyze, process, and classify heterogeneous data generated from many different sources so that it becomes useful for decision-making purposes. One important mission of the University of Costa Rica is to support the government in our research and development areas to improve society welfare. As part of this commitment, the university has carried out multiple COVID-19 projects and initiatives. The work being presented in this poster belongs to a bigger project consisting in the development of statistical models, reports, and a platform for decision-making support in Costa Rica government institutions related to COVID-19 pandemic. This platform's development is an important step to define directions of similar processes between other institutions. The platform being developed consists of a repository that unifies scattered data coming from different government institutions, but especially from the Ministry of Health. For instance, data about quarantine notices and health and safety-related accusations issued by the 911 emergency service are retrieved daily from web services. Data normalization was the most complex process due to the lack of standardized and structured data. Statistical indicators are designed using the stored data such as active cases, new cases, recovered patients, and deaths, as well as indicators of the virus spread at country or regional level. Also, socio-demographic information that allows to generate correlations regarding the virus evolutions. Those indicators can be displayed by date at different levels, like provinces or regions or districts. One important set of indicators that have been incorporated are those related to the national vaccination campaign, which include information of the number of applied vaccine doses and a model to estimate how many weeks are required to achieve herd immunity. The platform is developed using open source software, and the architecture is based on the model view controller pattern. In the data layer, it has a PostgreSQL database with special capabilities provided by PostGIS. The controller layers uses Python's Django framework, as well as a variety of data science libraries for data processing and visualizations. In the view layer, HTML, CSS, and JavaScript technologies are used. And finally, Leaflet is used to provide interactive maps capabilities. I wish to thank all the people who work on these projects and are still working, but it's impossible to name all of them. The platform is still in continuous review and testing due to the changing nature of the information and the new data being generated daily. There are many improvements and features that still can be incorporated into the platform. Among them are the design of new machine learning models to forecast the pandemic evolutions and the individual's behavior according to the various confinement measures. Finally, I like to point out that using new technologies in developing countries represent both a challenge and a great opportunity that must be strengthened for enhancing public health strategies. Thank you.
Hi everybody, my name is Katrina Lawson. I work at Oxford University Clinical Research Unit and I'm based in Ho Chi Minh City in Vietnam. I'd like to share some slides with you as I talk about our Outbreak Advisory Board, which we set up last year in response to the outbreak of COVID-19 in Vietnam. But the aim is actually that this advisory board exists in perpetuity, and after the COVID-19 crisis has passed, it will be an outbreak preparation advisory board. OCRU is a research organization. Mainly we do clinical research as well as lab-based research, but we also have mathematical modeling, social sciences, and public engagement, and we have been in Vietnam now for 30 years. Our vision is to have local, regional, and global impact on health by leading a locally driven research program on infectious diseases in Southeast Asia. We know that we can only achieve that impact if we are in frequent and high quality communication with those who are the decision makers and who have the power to actually influence policy and real change in the world. For us, policy engagement means creating a cycle of continuous engagement and communication with policymakers, or between policymakers and researchers. We aim in the policy engagement team to create opportunities for researchers and policymakers to connect throughout all stages of the research cycle. So from project design, or even before project is designed, throughout the course of the research, during the interpretation of the results of the research, and sharing the outcomes of that research. But we also want to ensure that our policy engagement is not just about research projects or specific project by project engagement. We want to engage on a program level. And so for outbreak advice, in particular, the program of our outbreak response research is important because there are synergies to be gained from that happen within a program of research, and many projects can relate to one another, feed into one another, and have interconnectedness for the policymakers as well. 2020 and 2021, these have been difficult years. There are many challenges, but there are also opportunities that come with those challenges. For infectious disease researchers like us, there are lots of new ideas, there's new research, there's new projects, there's new opportunities to collaborate, and in particular, new opportunities to collaborate with government. And we have found that government has been very willing to collaborate and very willing to work with us, and have requested us to work with them as well. And quickly, the speed of response has been really unprecedented. So this feels like a great time to start an advisory board. And I would like to, if anyone else is there from the research world, this is a really easy intervention to set up. First, we did some stakeholder mapping. We identified who the key players are. We looked, when we say key players, we did look at organizations. We looked at government departments, national and regional, because both are important in Vietnam. We looked at the hospitals, who are also important because they do play a really key role in policy development in Vietnam. We looked at international and national health-focused NGOs, such as the US CDC and the World Health Organization, who are very active in Vietnam. The objective of our OB is to provide that forum that we were talking about before, for discussion, for communication, to ensure that our response as a research organization is useful for our stakeholders' needs, and also to strengthen the networks that already exist between our researchers and the stakeholders. And that is also a side benefit, has been that we have seen that it gives an opportunity for our stakeholders to connect with one another as well. We did it by Zoom. You know, it's not a surprise, I think, that we couldn't meet face-to-face the way we normally would. These are short, structured, very well-planned meetings. We usually have 1 or 2 questions and that's it. 10 stakeholders externally, around 5 researchers from Oulu. It's cheap. Anyone can join from anywhere, even just on their phone. We can have live translation and real-time communication. It's just a Zoom call. But it has been useful. We continuously evaluate our policy engagement programs, and we have had really positive comments already just from our researchers' side and also from our stakeholders. We asked them, is this working for you? And this is what they said. One thing that I think it's worth pointing out that is potentially a limitation is that during moments of real crisis, so for example, right now in Vietnam, we are dealing with a big outbreak for the Delta virus, and we have really large level lockdowns in Ho Chi Minh City. We can't realistically host even a Zoom call right now because people are just too busy. It's a crisis. However, that crisis will pass. And the benefit is that we have the platform in place, the relationships are established and they're active. And as soon as it's possible, we will hold the next meeting and we'll be ready to prepare for the next moment of crisis. And that is the real advantage of setting up a board or something like a board, is that we can develop the relationships and have the platform ready to go as soon as everybody is able to participate. I want to thank you all for your time today, and I hope this has been an interesting idea for you.
Finland has been affected by coronavirus pandemic as much as the rest of the Europe. However, in February 2020, Finland didn't have any science advice mechanism to the government in place. So at the time, in the midst of the crisis, it had to rely on the advice provided by the Finnish Institute for Health and Welfare that provides reliable information on health issues. At the same time, ad hoc, a rapid model of science advice was developed. The Prime Minister's office set a study group to study the effects, impacts and consequences of coronavirus crisis. The study group was assisted by a science panel. This science advice panel was created by nominations from a consortium of research institutes and Finnish Academy of Science. Additionally, 3 members were nominated directly by the government. The science panel included experts from very diverse backgrounds. It had experts in public health, behavioral science, including psychology, also resilience experts, social and economic policies expert, and also environmental and climate science experts. So their science panel took part in the meetings of the study group and also prepared answers to very concrete questions that were asked by the study group. I also participated in preparing science communication. The main idea was to support the government with advice and evaluation of consequences and impacts of the coronavirus crisis, taking into consideration social, health, environmental, and climate sustainability, and also resilience of individuals, society, and communities. The science panel did not take any stance on the strategies proposed by the government. So the evidence suggests that this science advice mechanism had to be developed really quickly and adjusted during the time of the pandemic. At the same time, the newest report published in May 2021 on the state of science diplomacy in Finland proposes several recommendations on how science diplomacy can be developed in Finland. And first of all, it suggests that there should be a broader debate on how to incorporate science diplomacy in different spheres of society. And based on that debate, some concrete document should be produced, whether it's a statement or a strategy. It yet needs to be seen. But the report also advises using existing networks for provision of science diplomacy. And it needs to be further evaluated whether this ad hoc rapid science advice mechanism can be modified and used later in development of science diplomacy practices in Finland.
And so we would have to say, nope, we want to know what the state of the art is. We want the evidence, and we will develop the recommendations.
If there is a substantial challenge presented to how that knowledge is assessed and or communicated, it may in fact reflect some flaws in the formal advisory process.
If we take this extreme view that any contact or any strategic decision of how you communicate is already a breach of integrity, we really run the risk of a lot of precious knowledge being lost.
Prime Minister, we think there'll be a minimum of at least so many people likely to be affected and a maximum of so many. We don't know what it will be in the middle. Prime Ministers can work to that. You don't need to go in there and say, Prime Minister, we think that next week there'll be 357 people admitted to hospital.
INGSA has become a lot more, I think, engaged in the science policy interface, not giving recommendations per se, but definitely trying to make a real effort in ensuring that the science that they're delivering is able to be utilised in decision making.
But what this crisis has taught us is that basic discovery, pointy-headed scientists like me have had to get out into the real world, in this case the medical world, and we have forged all sorts of links to those involved in medical practice.
Humanities need to get away from this typical, mode of complaining. Why aren't we being paid attention to? Why aren't we actually, since we are so good in transmitting the instruments of discrimination?
Carl Hennigan, who's the director of the University of Oxford Centre for Evidence-Based Medicine, and he wrote a piece in the Spectator about masks, raising some questions about their efficiency, and this piece then got shared on Facebook where it got classified as misinformation.
Science diplomacy has always been very supply-side driven. You have the science ministries, the science advisors, the science institutions, all talking about the great good of science and how we can help the diplomats and so on. But there's still a lack on the demand side. Actually, diplomats approaching the scientists and demanding solutions.
So sometimes you see that people say, well, that's our cultural identity, and that's all. There's no ethical objection to that. And I don't think so. I think ethics has to take serious what culture says about the values of people and their way of living, but there should nevertheless be the possibility to ask whether these cultural habits align to human rights.
The other extreme is like the US. And so in a culture where it's about me, myself, and I mean, you can't really have collective action where populations are saying, even wearing a mask, which you would argue would be a non-starter, that becomes then an infringement of your personal me, myself, and I philosophy.
People say in all kinds of contexts that science is a new religion, blah, blah. I never quite buy it. But then what you've just said puts me in mind of these medieval cathedrals where the person who designed it or the person who commissioned and paid for it knew full well it would take 100 years to build and they would never see it completed, but they did it anyway.
This is the modern times cathedral,
In the US, we have looked at public trust in scientists over time, since before the outbreak to after it. And there we saw public trust in scientists go up, but it turns out that upward trend only occurs among Democrats, and has stayed about the same among Republicans.
They are completely free to give their advice and express their opinions to politicians, but actually there is a responsibility that goes with the role to not then dissent from that publicly.
They more see the science as like icing on the cake, that if they can put in some cool little science Easter eggs or come up with some really wacky ideas that are rooted in science, they really like that.
Kind of got to a stage with it all where it's embarrassing to say, by the way, I have no idea what you're talking about.
Yes.
Hello, my name is Andrew Millar. I'm Scottish Government's Chief Scientific Advisor for the Environment, Natural Resources and Agriculture. Today I'd like to introduce the Scottish Centres of Expertise. These are boundary organisations. Each one is quite lightweight. It employs between 5 to 10 staff, and they mediate the interface between researchers, policymakers, and stakeholders of various sorts in the particular areas in which they work, which are shown behind me on the slide background. In its area, each centre has 3 roles. First, they help policymakers to articulate their evidence needs in the form of researchable questions. The centre is then responsible for assembling a delivery consortium that's going to address those questions. And finally, the centre helps the consortium members to format their findings and outputs in such a way that they form the most useful evidence for input to policy. These typically involve quite focused projects, so maybe taking some weeks to a few months of research effort. Some centres employ core research staff to address the smallest projects in series, one after another. More typically, though, the delivery consortium is formed from a mixture of researchers from one or several different universities, staff from Scottish government-supported research institutes, and a range of stakeholders that just depends on the question at hand. You can see that centres have a really important boundary-spanning role, and the staff who most exemplify that are the centre manager and the centre director. These are professional networkers. They nurture relationships with the policy team in their particular area and with the major research groups in Scotland. 4 of the centres are specialised in particular policy areas, so water, climate exchange, animal disease and plant health. One's more general. The Safari Gateway covers a whole range of different areas. Let's look at an example to see how those work. So the climate exchange, not surprisingly, has worked for some years on peatland restoration. You'll be well aware that peatlands can be a significant source of greenhouse gas emissions because they are a fantastic carbon store. When they're in good condition, peatlands form a biodiverse habitat, they reduce flood risk, and they have other co-benefits. So, not surprising then that climate exchange research projects have included work on peatland restoration. That might be in mapping drained sites, it might be in understanding the practicalities of restoration, it might be in facilitating discussions on monitoring peatland condition before, during, and after the restoration work. The key advantage of having a centre of expertise, though, is perhaps best illustrated when we look at what happens after that first round of policy. Climate Exchange has had projects which moved from policy evaluation through to formulating the next round of research questions. Those involved looking at the impacts of early restoration work, talking with the first people involved in doing restoration, the early adopters, and understanding their experiences, and finally bringing together a range of those different people to prioritize the research needs for future restoration policy. As a result of this, in part, Scottish Government recently committed £250 million over 10 years to deliver a many-fold increase in the rate of peatland restoration as a contribution to mitigating climate change. So this is one example of those interactions between policy teams, researchers, and stakeholders, which are crucial for all the centres of expertise. They're quite distinct in style, in leadership, and in governance, as you might expect, because of the different areas they work in. Each centre, though, has the same ethos, which is to deliver evidence with impact. For a government with growing competencies like Scottish Government and a very rich research ecosystem to draw on, this model has been extremely effective. It's quite a modest investment. You can see that that investment is not in facilities or infrastructure, at least not in the sense of online resources or anything like that. This is primarily an investment in the human connections that form that science policy stakeholder interface. So it's an investment in the social infrastructure of science. I think it's a really interesting model, and I'd be very happy to answer any questions that you might have on it. Thank you very much.
Well, as you heard, there were very interesting projects and so much still to learn, to explore, and to discuss. Tomorrow, we will continue our discussions on exploring the power of science diplomacy on linking science to policy. Until then.